Sorry, I didn't see you there. Hi, my name's Afshin Baniseth, and I'm part of the team that's going to be talking to you today about phantom limb and phantom limb pain.
Hello there, my name is Spencer Goodman, and did you know that over 1.6 million Americans are currently living with an amputated limb? About half of these cases are due to dysvascular disease, which is commonly associated with diabetes.
I'm Wilfred Brimley, and I'd like to talk to you for a few minutes about diabetes.
A small percentage is associated with cancer, whereas the remaining 40% or so are primarily due to trauma.
Now stand aside, worthy adversary.
'Tis but a scratch.
A scratch? Your arm's off.
No, it isn't.
Well, what's that then?
Hi, I'm Michael Vale. Besides for the initial possible complications with surgery, these patients also face a syndrome known as phantom limb. Phantom limb syndrome is a condition characterized by the feeling of sensations or other pain as if the limb is still intact.
So how does the body normally sense information in a limb? Receptors fire electrical impulses and send this information to the somatosensory cortex of the brain, where we process information regarding touch, temperature, and pain.
But what actually causes this sensation of phantom limbs? Groundbreaking work by UCSD neuroscientist Dr. Ramachandran has suggested that this is due to a reorganization of the somatosensory cortex in the brain, as opposed to the previous beliefs which suggested that amputated neurons continue to send junk signals to the brain.
Within the somatosensory cortex in the brain, there's a map with the region corresponding to each part of the body. Whenever you stimulate the hand, for example, then the corresponding region within the brain for the hand is stimulated. However, if a limb is amputated, for example your arm, then that region in the somatosensory cortex becomes unused. Neuronal plasticity, however, allows aberrant activation of this region by parts in the body whose somatosensory region is adjacent. For example, the arm region in the somatosensory cortex is adjacent to the face region. This fact was actually involved in one of Dr. Ramachandran's patients, which this video will illustrate for you.
I want to touch different parts of your body, and I just want you to tell me what you feel and where you experience the sensation, okay?
Okay.
Close your eyes.
Could feel that on my forehead.
Anything anywhere else?
No.
Okay.
It's on my nose.
Okay.
My chest.
Your chest, okay.
I can feel that on my cheek, and I can feel rubbing on the phantom left hand.
On the phantom left hand, in addition to your cheek.
There's a variety of ways of treating phantom limb and phantom limb pain. These include pharmaceuticals, electrical stimulation of the spine, as well as virtual reality. However, one of the most simple and effective ways is mirror therapy.
When the patient uses the mirror and looks into it and sees the reflected image of the intact hand or foot, they think it is the amputated hand or foot returned. By doing movements, you are basically quieting down the excess activity in the brain that may be generating the phantom limb.
Interestingly, phantom pain is not just limited to limbs. Phantom pain can also occur as phantom menstrual cramps after a hysterectomy or rectal pain after a colostomy.
Well, we hope you enjoyed learning about phantom limbs with us today. Until next time, remember, keep it together!